Okay, okay. You're welcome. I'm Dr. Shehu Gandhi Yahaya.
Nice to meet
You're
you.
welcome. So I am listening. So as you ask question, I will continue to ask the patient.
Okay.
This is the patient.
All right. Can I ask what his name is?
Please speak a bit loud. I'm not hearing you.
Oh, okay. Can I ask what his name is?
Yes, me sunanka.
Okay.
His name is Aliyu Yahaya.
Okay. How old is he?
I didn't get you.
How old is he?
Shekarunka nawa? He is 8 years old.
Okay. Can I ask what brought him in?
You said.
I said what brought him in, like what's
Okay, me da me yake damunka? Aminu, kar kai bacci. Aliyu, kar kai bacci. Me yake damunka? Yes, he come here today morning with complaint of fever, headache, and convulsion. The fever and the headache were for 2 days duration while he convulsed today before coming to the hospital.
Okay, I'm sorry to hear that. So is the fever, is it continuous or does it break at all?
Okay, zazzabin nan yana ta ci gaba da yi maka ne har yau? Ka yi magana mana. Zazzabin yana ci gaba da yi maka ne har yau? He said the fever, yesterday it was on and off, but today the fever is continuous.
Okay. How has his appetite been? Has he been able to eat?
I didn't get you.
His appetite, how has that been? Has he been
Kana jin amai ko ka ji baka iya cin abinci? There is no loss of appetite, no vomiting.
Okay. What about any, like a runny nose or a cough or anything like that?
Kana tari ko kana samun zuban majina? Akwai tari ko yoyon majina? No cough, no running nose.
Okay. Could you take his temperature, or do you know what his temperature is?
Yes, the temperature from our thermometer reaches 37.8 degrees centigrade.
Okay. What about has he had like any stomach problems? Like
I'm not hearing you.
Has he had any stomach problems? Like
Akwai ciwon
constipation
ciki ne?
or diarrhea?
No stomach problem. There is no abdominal pain.
Okay, so no diarrhea or anything like that either?
Akwai zawo? There is no diarrhea.
Okay. What about weakness?
I didn't get you.
Weakness? Weakness or like muscle pain or anything?
No, he doesn't have all that.
Okay. So I suspect that he has malaria. But since you also said that his fever has been continuous today, I also want to do a blood culture to test for typhoid and then the RDT for malaria. And then I don't suspect that he has anemia, but could you just go ahead and check his hemoglobin levels just to make sure?
Yes, that's good. The first line treatment for malaria being atomycin in combination therapy, and you usually diagnose malaria with rapid diagnostic tests, those as you mentioned, which may show 1, 2, or 3 pluses. In his own case, is 2 pluses indicating simple malaria,
Mm-hmm.
while the fact that the fever is continuous. Apart from malaria, did you also suspect another illness
Yes.
apart from malaria?
Yes, I said I suspected
Yeah,
typhoid.
yes,
So,
that's beautiful. Another possibility is typhoid. We so is there any test you would like to run to confirm your typhoid?
a blood culture.
Yes, blood culture is the gold standard. When you culture, it will yield the organism that is Salmonella, either typhi, paratyphi, typhimurium, or the rest. We have about 8 species of the typhoid that are usually cultured. And also, you may wish to run a full blood count. It will also give you a picture of typhoid. Here, commonly, we usually do what is called the Widal test. If the Widal test is 1 over 180 and above, is usually significant, indicating typhoid. So, how do you think? How can you treat the typhoid?
Um, for typhoid, I think just antimicrobial therapy.
Yes, that's beautiful. Typhoid fever is usually treated with antimicrobials, that's antibacterials. Usually, we give the broad spectrum antibacterials. Here, commonly in children, we use the penicillin based like the amoxicillin or augmentin, amoxicillin clavulanic acid. We discourage using ciprofloxacin in children because it usually affects their bone marrow. It makes them not to grow well until after in the adults that we usually administer ciprofloxacin. So, is there any advice you may wish to give this child for prevention against malaria and as well typhoid?
Well, to prevent malaria in the future, I would suggest mosquito nets and wearing long sleeves, especially at night. So, if you can, to avoid going out at night, but if you will, definitely long sleeves. And then for typhoid, I would suggest to improve hygiene and sanitation and to, like, wash your hands frequently. Yeah.
That's beautiful. That's excellent. That's excellent. I hope you will be a doctor in the near future. You're welcome to the club. Yeah, you're welcome. If there is there any other contribution you may wish to make?
No, I think that's it.
Okay, thank you.
Thank you.
Thank you. You're welcome. It's nice having you on board.